Hello, my name is Giuseppe Tarantini. I'm the Chief of Interventional Cardiology at the University of Padua, and today we're going to discuss the ROLEX study results. The PCI is a well-established way of treatment of the unprotected left main disease. And actually we have, according to our guidelines, a class 1 or 2 recommendation based on the complexity of the coronary artery disease. So actually in this recommendation is mainly based on previous studies where they used workhorse DES. That means that in these families, we don't have any extra large size. So we decided to use a new family that is the Onyx family that included in the last generation version also the extra large size. And we aimed to look at the results of the use of all these different sizes in the context of left main disease. The device used in the study actually is the Onyx stent, that is a Resolute drug-eluting stent, that is a metallic stent with a permanent platform and elution of zodarolimus. Actually, this is the latest generation because include a new size that is the extra large size that is 4.5 and 5 millimeter that can cover a range size up to 6 millimeter in the vessel. The study design is a prospective multinational multicenter registry that includes 450 patients with left main disease and the SINTA score that is less than 32. These actually are patients with unprotected left main, and actually we studied this patient also with the use of a core lab for all angiographic evaluation and an independent adjudication committee to adjudicate all the events along the way of the study. So the primary endpoint was the target lesion failure that include cardiac mortality, target vessel MI, and ischemic-driven revascularization in this patient. So we enrolled 450 patients based on a new study design that is the performance goal. So we aim to look at a target lesion failure that has to be less than 7%. To do that with an alpha error of 0.05, we finished up having this kind of sample size that is 450 patients. The main findings of this study are that the use of this latest platform of the Onyx family, brought a great result of 5%, only 5% of target lesion revascularization, with actually a very low rate of adverse single-digit events rate, with a stent thrombosis of just 1%. Actually, there were 5 patients with stent thrombosis, and 2 of them discontinued the dual antiplatelet therapy. So I think the results are very, very promising. The second point is that we foresaw some sub-analysis, including the imaging-based sub-analysis. And when we found that in 50%, we used IVUS, to evaluate more carefully the stent size and so on, and the length of the stent, etc. And when we used the IVUS in 240 patients, more or less, the outcome was half of the one of the general population. That means less than 2%. 2% is remarkable because also if you look at the data, when you use IVUS, you increase, the use of an extra large platform. That means in 18 to 20%, you need to upsize the stent to be more appropriate for the patient. Our key takeaways for this study are the following. That's thinking as an operator, like an interventional cardiologist. Probably the 2 most important messages are that we need the whole sizes, including the extra large sizes with the stent platform. And secondly, we strongly recommend the use of IVUS because the use of IVUS reduce significantly the rate of major adverse events. And actually this registry confirmed but extend also the result of previous studies in this regard. The next step might be to run future trial or comparison between surgery and PCI with the use of the latest generation stent that include also the extra large plus the mandatory use of imaging, and to find out if we can reduce significantly the gap that we have still so far with surgery in this kind of patients.